Hi, I'm Brad Chambers, president of MedStar Good Samaritan and MedStar Union Memorial Hospitals. Stroke is the #1 cause of death globally and the #5 cause of death nationally and the leading cause of disability right here in the United States. MedStar Health is proud to team up with the American Stroke Association, a subsidiary of the American Heart Association, to prevent, treat, and beat stroke by funding innovative research, fighting for stronger health policies, and providing life-saving tools and educational information. I'm here today with Dr. George Bitar, Regional Medical Director of Ambulatory Cardiology for MedStar Health in Baltimore. George is going to take my blood pressure and check to ensure that I'm taking the necessary steps to ensure a healthy lifestyle.
Thanks, Brad. But before I check his blood pressure, let's discuss what these readings actually mean. A lot of my patients want to know, why are there two numbers? Why is there an upper number and a lower number? And why do you talk about them in a ratio? Well, the upper blood pressure number is called the systolic reading, and that is a reflection of the arterial pressure with each heartbeat. The lower number, the diastolic pressure, is the reading that corresponds to the arterial pressure when the heart is at rest. And it's the combination of these two numbers that allows us to determine if you have a normal blood pressure or a high blood pressure. So what is the best way to check your blood pressure? Well, if you're in the doctor's office, your physician may check it in one of many different ways. You may be lying down, sitting up, or standing. However, if you're checking it at home, we want you in a very relaxed state, not having rushed in from outside or going from one place to the next. You should be sitting on a chair with a straight back, feet planted firmly on the ground, and not have had necessarily any caffeine or tobacco immediately prior to doing this. What's equally important is having the right blood pressure cuff size. And there are 4 cuffs that we use, and that again is all based on your weight and your body habitus, your frame. The latest evidence shows that blood pressure readings of less than 120 millimeters systolic or less than 80 millimeters diastolic, the upper and lower numbers, reflect a normal state, a normal blood pressure state. If your blood pressure is between 120 millimeters and 129 millimeters systolic and approximately 80 millimeters diastolic, that is mildly elevated by today's criteria. If you're 130 to 139 millimeters systolic with a diastolic reading of greater than 90 millimeters, we consider that stage 1 hypertension. Above 140 millimeters systolic and greater than 90 millimeters diastolic is considered stage 2 hypertension. And if your blood pressure readings are greater than 180 millimeters systolic and greater than 120 millimeters diastolic, that is something we would call hypertensive urgency or emergency based on whether or not you're having symptoms. And truthfully, you should be contacting your physician to discuss next plans if you get readings such as that. So now you have your blood pressure reading, you know whether you're normotensive or hypertensive. What can you do? You are your best advocate. You must take control of your health. And how can you do that? By making behavioral changes. So the American Heart Association has what we call the 3 C's: check, change, and control. So we'll focus on the second one, the change. How do you change? You eat smart. You eat lean protein, be it beef, poultry, fish. Try not to fry it. You want to eat a lot of vegetables, a lot of fruit, and avoid the high concentrated sweets, the highly salted foods, the processed foods, or those with polyunsaturated fats. We want you to move more, exercise. Any form of aerobic exercise is great and will help lower your blood pressure. We want you not to smoke, so do not smoke, or if you do smoke, then we will work with you. Your providers will work with you to try to help you discontinue that habit. We want you to get sleep. And when we talk about sleep, we're talking more than 8 hours of sleep. Those patients that sleep less than 6 hours are prone to elevated blood pressure readings. Lastly, we want you to maintain your weight. If you are of a normal weight, we want you to stay that way, again, through diet and exercise. If you're carrying more weight than you should, the goal should be weight loss through adherence to a Heart Smart calorie-restricted diet, and a regular exercise regimen. If with these changes, your blood pressure still is high, next step is control, and that's where you work with your provider to see what best medication will help lower your blood pressure to a normal reading. We did check Brad's blood pressure, and it was 124 over 80 millimeters of mercury. I'm very happy with that number, and I know Brad is also.